Hello, my name is Hannah Grumke. I'm a student midwife, and this is a short video on tips and tricks for hygiene during pregnancy. So, first of all, we know that hormones change drastically throughout the course of pregnancy, and these changes will inherently affect different parts of your body in different ways. First of all, hormone changes can actually affect your teeth and your oral health so much. So I really encourage you to floss at least once a day, brushing your teeth twice a day, once in the morning and once in the evening. We recommend that you go to the dentist if you haven't in the last 6 months. Going to the dentist is actually completely safe during pregnancy, and most of the procedures that could be recommended by your dentist are also safe during pregnancy as well. If you are having morning sickness, a good tip is to rinse your mouth with baking soda water afterwards to neutralize the acids from the bile, and then brushing your teeth afterwards to kind of get that taste out of your mouth and prevent the acid from affecting your teeth. Also, we like to tell clients if they're suffering from morning sickness to have a snack if they wake up in the middle of the night. If that's you and you're having a 3 a.m. snack when you get up to go to the bathroom, which is great, maybe rinse out your mouth, maybe brush your teeth really quickly before you go back to bed, again to prevent cavities from forming and any plaque buildup during this time as well. Your breast and chest tissue will also change during pregnancy. As you get further along in your pregnancy, your body will start to create colostrum, and sometimes that can start leaking prior to when you have your baby. So daily you can use a warm water and a cleanser on this area, just kind of washing out any dried pieces of colostrum, making sure the area is clean. If you're noticing leaking, you can also use breast pads to stay dry and prevent irritation. And also, you want to make sure you're wearing a comfortable and well-fitting bra during pregnancy. If not, it can cause a lot of discomfort, so we want to make sure we're supporting our bodies in all of the ways as we change and get closer to the end. For your vulva, we want to make sure we're keeping the area clean. Again, the hormone changes during pregnancy can cause so many changes in your vaginal flora. We often ask in visits if you have any odor, any foul discharge, any extreme changes in your discharge that we would be concerned about. If not, if there's no pain or odor or coloration beyond the normal, all of those changes are completely within normal limits. And to support yourself through that, you can just use a gentle cleanser. You can actually just use Cetaphil or CeraVe and just pump a little bit on your hands, rinse the area. You don't even have to use soap, you can just use water. You don't want to scrub the area. It's important to remember that our bodies have so much good microbiome and flora, and our babies actually really benefit from receiving that from us when they go through the vaginal canal during delivery. So as much as we can, we want to make sure we're avoiding douching or anything inserted into the vagina, any boric acid, all of those kind of cleaning feminine products are actually to be avoided even outside of pregnancy. They actually affect your pH balance negatively and can actually increase the risk of infections and STIs during pregnancy and outside of pregnancy. When we're washing our hands, we want to make sure we're doing it for at least 20 seconds with soap and warm water after we use the bathroom, before eating or preparing food, after blowing your nose, coughing or sneezing, after touching pets or being in public and touching public surfaces. If you don't have soap and water, making sure you're using high alcohol hand sanitizer. You can just carry some with you in your bag in case you're out in public and you don't have access to washing your hands. And lastly, with flu season upon us, there's a few extra steps you can take during pregnancy to prevent getting ill, as we know our immune systems can be negatively affected more so during pregnancy than other times of our lives. You can talk to your midwives about getting vaccinated against the flu and COVID-19. If you are sick or you're around people that are sick, you can wear a mask in crowded or enclosed spaces, and also just avoiding contact with people who are sick. And then if you want, you can disinfect areas of your house, doorknobs, light switches, places, your phone, things that you use often. Just kind of keep those areas clean, making sure you're sticking to a balanced diet, eating well, and if you're not feeling well, reach out for medical advice and rest as much as you can, taking care of yourself and kind of slowing things down to give your body a chance to heal. These are a few tips and tricks of how to get through pregnancy and hygiene throughout pregnancy. If you want, you can see my additional handout that I will give you at your visit, and I hope you have a great rest of your day.